Poisons are classified into corrosives, irritants, and system specific. Example of corrosives, we know they are acid and alkali. Irritants are further classified as metallic, non-metallic, plant origin, animal, and mechanical. System specific, you can pause the video and go through each example. Now if the question it says that the man he is drinking water from ground source, or if the farmer he is using pesticide, or if the soil is from an endemic region like West Bengal or Bangladesh, then you should suspect arsenic poisoning. If the question it says that the man he is drinking water from lead pipes, or if the woman is using cosmetic products, or if the man is painter by profession, or if the child he is mouthing the toys, then you should suspect lead poisoning. If the question says that the man he is from Japan and he is eating tuna fish, or if the thermometer it has fallen down from the table and there is spillage, then you should suspect mercury poisoning. Source of each toxin I have mentioned in previous slide using the pictures. Now comes the route, which means how are they going to enter the body, and source for all three poison is same, it is GI tract, except that in lead poisoning in adults it enters through the respiratory tract. Arsenic inhibits pyruvate dehydrogenase enzyme. Lead inhibits aldehyde ferrochelatase enzyme, which are involved in heme metabolism. It also inhibits pyrimidine 5-nucleotidase, which is responsible for basophilic stippling in RBCs. Mercury inhibits glutathione metabolism. All three poisons, arsenic, lead and mercury, during their acute toxicity affect the GI system, and so it is also the route of entry. So that's how you can remember it. And apart from GI tract, in lead acute toxicity also affects the bone marrow, and in mercury it affects the respiratory system also. Chronic toxicity of lead and mercury, it affects central nervous system and renal system, whereas in arsenic, chronic toxicity is seen in skin. You can remember this as the clinical feature of arsenic is also skin related, like raindrop hyperpigmentation, then hyperkeratosis, melanosis, blackfoot disease. Coming to clinical feature, there is a mnemonic for each poison. For arsenic, it is arsenic. A for Aldrich-Mees-Lying, which is nothing but transverse white band on the nails. R for raindrop pigmentation. R for red velvet mucosa, which is post-mortem finding of stomach. S for subendocardial hemorrhage, which is post-mortem finding in heart. E for excessive pigmentation, blackfoot disease. N for neuritis. I for iron oxide plus ball, which is a treatment of arsenic poisoning, although iron oxide is obsolete as an antidote now. C for cholera like illness. Now there are certain poisons which mimics the disease. For example, arsenic mimicking cholera, thallium mimicking Guillain-Barré syndrome, strychnine mimicking tetanus, phenol alkaptonuria, zinc malarial chills, phosphorus acute yellow atrophy of liver, organophosphorus compound asthma. Clinical features of lead can be remembered with the mnemonic A, B, C, D, E, F. A for anemia with basophilic stippling. B for Burtonian line, which is bluish grey line on gums. C for constipation and abdominal pain, or also known as colicky. D for wrist drop, foot drop, which is neuropathy, also seen as Bell's palsy. E for encephalopathy, which is most commonly seen in infants. And F for facial pallor, which is circumoral, and it is the earliest sign seen in lead poisoning. Clinical features of the mercury can be remembered with mnemonic MEATS, MEATS, M for mercurialentis, M for Mina-Marta disease, M for membranous nephropathy, M for membranous colitis, E for erethism, which is nothing but personality disturbance, memory loss and insomnia, A for acrodynia or Pink's disease, T for tremors, which are coarse, and it is also known as Danbury tremor, Hatter's or glass blower shakes. S for salivation, which is excessive salivation. Now this is the picture which are seen in arsenic poisoning, Aldrich-Mees-Lying, which is transverse white band on nail, and this is also known as leukonychia. There are certain differential diagnoses which I will explain in the next slide. Second image is raindrop hyperpigmentation, and third is blackfoot disease. Leukonychia. Leukonychia, they are of two types, true and apparent. True defect is in the nail matrix, apparent defect is in the nail bed. Example of true leukonychia is Mees-Lying, and example of apparent leukonychia are three: Murex band, which is seen in hypoalbuminemia and chemotherapy. Second is Lindsay nails, which are seen in chronic renal failure, and third is Terry nails, which are seen in liver cirrhosis. Blackfoot disease seen in arsenic is due to vasospasm, platelet activation and hypercoagulation. Now inorganic arsenic is more toxic than organic arsenic, and in a similar way trivalent arsenic is more toxic than pentavalent. and this arsenic is also used in the treatment of acute promyelocytic leukemia M3 variety. As I mentioned, arsenic is endemic in West Bengal, Bangladesh, and it is most commonly used homicidal drug, and ideal being the thallium. And arsenic poisoning leads to garlicky odor. This is the basophilic stippling, Burtonian line, and wrist drop, foot drop seen in lead toxicity. Chronic poisoning in lead is also known as plumbism, Saturnism, and Meniere's disease, and abdominal pain is called Devon's or Painter's colic. Burtonian line in copper poisoning is called Clapton's line, whereas lead, it decreases the uric acid excretion, and therefore it leads to something which is known as Saturnine gout. Now this is seen in mercury poisoning. First one is mercurial lentis, second is Minamata disease, which affects the central nervous system, and third one is Pink's disease or acrodynia. Now mercurial lentis is nothing but mild brown reflex which is seen due to deposition on the anterior lens of the capsule. In this the vision is not affected. And mercury, they are of three types: elemental, inorganic, and organic. Organic seen in fish in Minamata disease, inorganic seen in industries, and elemental mercury seen in thermometer. When we consume this mercury, elemental mercury, it will not cause any symptoms unless our mucosa is damaged somewhere. And mercury also causes nephrotoxicity, as I mentioned, and it specifically affects the proximal convoluted tubules, and treatment of which is calcium gluconate. Lastly comes the diagnosis and treatment. For arsenic we check urine, for lead we check blood level, and for mercury we can check both blood and urine. And treatment for arsenic, it is British anti-lewisite or dimercaprol in acute toxicity, and Suximar or DMSA in chronic toxicity. For lead, Suximar is the single best chelator, or we can use EDTA plus BAL. For mercury we can use BAL or Suximar. Again, remember this mnemonic: BAL for mal, that is British anti-lewisite for mercury, arsenic, and lead. Thank you so much.